Looking at trigger points, what is a trigger point? Nobody knows. I'm just kidding. But what a trigger point is I like to say is if you look at the area of the muscle that gets the tightest tends to get overworked, repetitive movements. It gets real tight, and which causes a lot of swelling in the area, which irritates the nerve, which can cause pain. So what we do as therapists, and this is just a summary, there's a lot more detailed information, but what we do as therapists, we try to, like get on one of these trigger points, hold the pressure which reduces the blood flow, allows the blood flow to flow better, and calms the nervous system and the muscle relaxes. That's our goal. So let's go over to Miss Brittany. So this is Brittany. She has already been colored on by me. Here are some examples of trigger points. And as you saw in Mr. Steve, we had a lot of the muscles go in different directions. So you got some rotator cuff muscles going this direction. You got some muscles that connect to the spine going up into the neck. You got, basically they're going everywhere. So my goal is when I find a trigger point, I want to follow that specific muscle. And of course my videographer coughed, but she can't stop now, but that is okay. You can still hear me. So we're going to go over all of these, what to do. Like I said, I want to find the trigger point, and then when I do find a trigger point, I want to follow that specific muscle and find the area that it's the tightest and hold that pressure. So I've already, so what I mean is I've already found this spot right here. She's pretty tender. Brittany, you can say hello.
Hello.
Okay. So you feel that tension? Okay. So this can be some rhomboid action. This can be some traps. It can, but honestly, if you don't know what muscle it is, just find the tender spot. Don't do what I'm doing right now because that's going to hurt your thumb. That hyperextending. I like to actually put my thumb down like this, and I'm going to use the outer part of my hand to put weight onto my thumb, and I'm going to lean in. And notice how I'm leaning and not pushing straight down. I'm using my legs, my hips, and I'm going to ask her, how's the pressure? You want more or less? Okay. So trigger point can be taught in different ways, be done in different ways. A lot of therapists will hold it for like 30 seconds. I like to personally do a more pumping method. Hold for 7 seconds, back off, hold for 7 seconds, back off. And usually it gets a lot looser. So, and you know that because it gets less tender and then the muscle is not as taut. I used to not know what taut meant. It seemed like a made up word. She has trigger points everywhere because she's leans at a desk all day long, rolls her shoulders forward, and doesn't do the exercises that I tell her. But that's going to change soon. So let's go ahead and start a couple of these. Get some nice lotion. So we're going to deal with this specific trigger point right now first. So I'm warming it up, getting some blood flow in there, making friends with it. When I find these specific muscles, like I said, I like to get near the spine. Get some good pressure in there. You can do this. Hold your hand over it. Like I said, this is the same method. I'm putting my palm over my fingers. Hold, release. Hold, release. One thing I am doing, so when I find that trigger point, a lot of therapists will go towards it, they'll feel it, and then they'll just push down. The problem with that is a lot of times we slide off that way. So what I like to do, if I'm moving on to this trigger point, I'm going to go my way up there. I feel it. I'm going to back off. And I'm going to hold the pressure. Now, you can't see my hand. My hand's like this. Or I like to come around this way. It's all about how you use your body. I was stretched over too much. And now, again, use your legs. Lean in. So if you imagine this hand would be on it, but what I'm doing is I'm going near the spine and I'm pushing away, holding that pressure, letting it relax, holding it, letting it relax. Good. And always spread that blood flow around when you're done. Since the X's are going away, that means the trigger points are going away. That's a joke. Nobody laughed. I'm sure my audience is laughing. If you haven't already, please hit subscribe and ring the notification bell. You'll be always part of the Natural Forces family that way. Supporting a small business. So, also, I'll quickly go over an active trigger point compared to a latent trigger point. Latent means, you feel the knot built up in there, but they don't really feel it. So if they don't really feel it too much, it's not really that necessary. You're really looking for those active ones that are sending radiating pain to other areas of the body or localized. Those are the ones you really want to focus on. What I found also is some of these ones won't relax. If they're having trouble with that, it's good to get under here first, under that into the subscapularis. So I'm going to come over here. We're going to put some lotion on. I don't know why I said we, but I did. Again, I like to personally put my palm under and lift up. You're not pushing straight into the rib cage, because that's cruel. Not that what I'm doing is not cruel, but you're going up into the subscap. You know when they shake like that, you're in a good spot. How's that pressure? Okay. Now, I am slightly hyperextending here, putting a lot of pressure on my thumb. That's not good, but I'm just showing you as an example. Normally, I would have some support. Or I would hold their arm, come over here with my forearm, and lift up into it. Don't be afraid to ask them, too. Do you feel like I'm in the right spot? Good. Well, I knew I was in the right spot. I'm saying... No, I'm just playing. Good. Spreading that blood flow, like I said. Getting these muscles to relax. Then we got some over here. We got the Infraspinatus here. A lot of times you'll find some in the Teres minor. And then you can always get all the lats, all that. There's so many areas that you can find tension and release. And as you start releasing tension, you'll start finding out where is the real problem that she's having. She'll say it's her boss, but spreading that blood flow. So now one thing I also want to add is I don't like to just work trigger points with them in one position, because I find that we want to put the muscles in different lengths and shortened and all that so that we can release it a little bit better. Which means if I make her relax and she's in pain-free, never moving, as long as she stays there, she'll never hurt. But instead, I want to bring her in different positions. So I'm going to bring her arm down there. This is I really like doing this move. Feels pretty good. Even better, you can get your fingers like that. Now pretend my palm is on my fingers. It would be like here. And guide your way out. Now when you feel that trigger point, remember, if you're looking for it, you're going to feel a little taut area. Rock over it a little bit till you feel you're right on it. Hold and relax. And then do it a few times till you feel the muscle kind of let go. All right. Same thing here. we could always work that muscle in there. It's a little tender. So you always want to get the rotator cuff muscles. You got the infraspinatus. I got some teres minor over here. Supraspinatus. You can get right in there. And then you also, all these neck ones. I mean, you get a lot of muscles that are coming up into that neck. One thing I'll add is you can do what's called passive release. And how to do that is basically you can get a good trigger point. Let's say I come down here, pull their neck, wrap around in here. Now my forearm is in that spot. Does that feel tender? Mm-hmm. And then I'm going to pull their neck with it. Just don't pull their hair. Fortunately, people don't have that issue with me. And relax. And you know, do it a few times. Get it to relax. You're going to knead the area a little bit. Also, it feels really good. Remember, anytime you work some good trigger point work, you want to spread that blood flow around so they're not as sore. Next, we're going to show you an active release. And that's when, so the passive, you're trying to move the muscle that you're pinning. It's kind of pin and stretch. You hold the muscle down on the trigger point and lengthen the muscle and then shorten the muscle. Now we're going to do is I'm going to have her, she'll start here and then she's going to raise her arm and bring it to there and then come back. Now what I'm going to do is hold one of those good spots. Hang on. Again, I'm like this. Hold, remember, thumb over thumb. And go ahead, come up towards me. Lift up towards, up, there you go. And go down. And back. I mean, back to where you were originally. I was trying to see if you could hit Trinae. Trinae is our videographer, if I haven't already said it. She's hopefully doing an amazing job. And like I said, wash it out a little bit. You got some nice blood flow. You can also do some stretches, just get some mobility. I like to interlock my elbow. I'm going to get in a good squat so that I don't hurt my back. I'm going to lean back. Just don't pull their arm off. Good. And now I'm going to wrap their arm over here. If they have an impingement in their shoulder, they can't really do this motion, but this props the shoulder blade up. I'll put my hip in there. Not here, but my hip here to stabilize her. Again, getting into that subscap, trying to get under the shoulder blade a little bit. You feeling all that? Good. And normally I would just, after working that area real good, normally if I do trigger point, I'm only going to focus on maybe a few spots. I showed you a whole bunch of them, but where you maybe pick 3 or 4 of them that you really want to focus on. Spend maybe, 45 minutes, working it out, relaxing it first, then hitting the trigger points, then relaxing it again, spreading the blood flow, kind of sandwich it, do good or nice stuff, mean stuff, nice stuff. I actually like the way the trigger points feel. They help, you'll get a lot of relief, and I hope you liked this video. Please hit subscribe, hit the notification bell, and comment your thoughts, only if they're good ones. But just kidding, I appreciate criticism and feedback. It's always helpful. Like the video, follow us on Instagram and TikTok at Natural Forces Massage. Have a great day, and God bless.